please welcome to the stage Daniel Dawes, founding dean and SVP at the Meharry School of Global Health at Meharry Medical College, and author of the new study, The Projected Costs and Economic Impact of Mental Health Inequities in the United States.
All right, we just heard from some of our elected officials, very important conversation. Daniel, you are going to be here dropping some statistics, some facts for us. So thank you first and foremost for being here. You are here today with a new report about mental health disparities and the cost that these disparities in treatment and care have on our larger society. So before we get into some of those facts in the report, what led you down this path of research?
Ooh, good question. So this year marks almost 25 years to the date that Dr. David Satcher, for many of you who remember his work, he was the 16th Surgeon General of the United States. He was the first to issue a report, a landmark report on mental health. And as the pandemic was striking us, it helped us realize that when we dug into the data, going all the way back to the founding of the country, we had never ever during pandemics or epidemics realized an equitable response. And there were communities who were struggling, right, to attain their full health potential and mitigate the impact of the COVID pandemic or other epidemics in their lives. And we thought, okay, Dr. Satcher, you talked about mental health. We're seeing this coming to the fore, right? And for me, just as you heard, I had personal experiences in my own family that helped me realize we've got to study this. It's an underrated issue in health policy. We understand racial and ethnic health disparities in general with physical health conditions, but do we truly understand how diseases of the brain impact our systemic health? Do we understand how that fleshes out in terms of in economics and national security and the like? And for me, what really motivated me was when I had just come back. I was abroad, a different country, came back into the United States after a 9.5-hour flight. I turned on this phone, and this was probably around 2021. And I'm seeing a bunch of text messages pop up, seeing voicemail messages come up. And one of the voicemail messages caught my attention. It was from a cousin of mine, who I, love dearly, but we don't get to communicate that often. And I listened to the message. And in there, she says, Danny, my family calls me Danny, Danny, the doctor's trying to kill me. The doctor's trying to kill me. I need your help. I need your help. You need to call me back. Please help me, help me, help me. And I thought, who would dare try to kill my cousin? Who wants to kill this cousin? My dear cousin, been like a sister to me. And so I kept calling her number back, but I didn't get a response. Then I called her sister and I said to her sister, is she okay? I've been trying to reach her. What's going on? I can't get any answers. She says, well, Danny, there's something I got to tell you. And I said, what's that? And she said, she's okay. I said, oh, thank God. She's all right. But, and I know that she has had depression, okay? I said, yes, I remember that. She goes, but there's something that we've never told you all. And Mom didn't want the extended family to know. And I said, okay, so what's going on? And she said, she has bipolar disorder. And she's been struggling with this for years and years and years. Mom thought that we could keep it, we could manage it ourselves. We didn't need any external help. And as I was listening to the story, hearing all these things, it made me understand, wow, my poor cousin has been struggling in silence. She struggled with employment. She struggled with raising her children. She just struggled. And there was no one to help her outside of her mom and her sister. And I thought, that is unacceptable. The other story after that now, a few months after that, I was hosting a party at my house for one of my kids. And another beloved aunt says, Danny, can I pull you to the side? I said, sure, what's going on? She said, I need your help. I said, and so anyway, so she says, well, I said, what do you need my help with? She says, your cousin, such and such, has been struggling. I was trying to call him. I know he hasn't told you this yet, but I called and called and called a few weeks ago, and I was so scared. Call it mother's intuition, perhaps, right? But something told me he wasn't right. And she fortunately called a loved one who lived nearby to check on him, went to the apartment, got someone to open the door. and found that he's passed out on his floor. And he had attempted suicide, because at that point he had been enduring a job loss. He endured a divorce. He was in a terrible custody fight. All of these coupled, right, coming together, caused him to really go on this downward spiral. And it has been a struggle for him now to keep up, because he and his mom did not know how to access the mental health services and the treatments that he needed. In the first instance, they thought they could manage it on their own. They realized as they're getting older, it's much more difficult. In this instance, they just didn't know where to begin. And with all of my policy savvy, with all of the expertise and experience I had, getting down to that level to help them figure out how to maneuver this helped me realize, my God, what a fragmented system we have, right? And there's so much we need to do to help people navigate our health system more efficiently. So with that, after talking with her, helping them, going through that, I thought, gee, how many times is this happening across the United States? How many people like these cousins of mine are struggling as we become a more racially pluralistic society? I wanted to know, what were the past costs, the present and the future costs, right, of these inequities in health? The two folks that I mentioned are African Americans, and I wanted to truly understand if we could get into that data as far down as we could to understand the problem, and to then figure out how we can develop actionable, culturally competent solutions to help folks like them. And so that's what motivated me on that path. David Satcher's work telling us that we needed to focus on mental health, push it from the rear of the national consciousness to the front of our national consciousness. And then 15 years prior to his landmark report, a group of folks, Millicent Gorham and others I know were involved in that, worked with Margaret Heckler to develop the Heckler report. And in that report, those health equity champions said it is going to take efforts of monumental proportions to get the level of health with African Americans, Latinos, Asian Americans, Native Americans at the same level as white Americans. Monumental proportions. And yet here we are today, and we're going to unveil those numbers. We have not seen but very little progress in mental health equity.
So with your report then, what was some of the most striking numbers or information that you found?
Sure, well, if we could pull up the first slide, we have a slide to share with you. What we found looking at three segmented population groups, racial and ethnic populations, from the white population, Black, Latino, Asian American, and Native American, looking at socioeconomic status as well as age. We then looked at it in terms of four buckets, right? We wanted to look at emergency department utilization, what are the costs? When we fail to prevent and early intervene, we wanted to look also at the intersectional issues. Again, we have done economic studies looking at only physical health conditions. What does it look like with mental health inequities? And how does it look when you connect these two issues, right? Brain and body to get the full picture. That was the second. We also wanted to understand, in addition to that, the productivity loss. So in the first report that we did, it was published 2 years ago, and again, I want to thank Otsuka and our colleagues at Deloitte Health Equity Institute and of course the Meharry School of Global Health. But in there, we looked at productivity loss this time to understand how does this affect us to really engage, right? And to help build our society. So we looked at absenteeism, presenteeism, unemployment, and then lastly, premature death, which was the focus of our first report, looking at death by suicide, looking at death by overdose, drug overdoses, looking at death at mental health, the lack of mental health treatments, right, and what that led to in terms of spiraling with their underlying comorbidity. And so then with those points of view, we then dissected the data, looking at publicly sourced, privately sourced data, and what we found was even more revealing. In the first report, we could only get access to publicly sourced data. In this report, we got access to privately sourced data as well as publicly sourced data, and it helped us, again, connect the dots and figure out what was going on. And so in this one, we found that today, in 2024, we are spending as a nation $477.5 billion with a B. Okay, think about that. We know then that as we are increasingly becoming diverse, and at the rate we are going in terms of this mental health crisis, we know that in 2022 CDC last year highlighted the fact that we had the highest rate of suicide in this country, and that is close to 1941 when we were going through World War II. That again should shake the conscience a little bit. But as we are moving forward, it became very clear that by 2030, we were going to hit that $1 trillion mark, again, owing to just the inequities in mental health status and mental health care treatments. So $1.26 trillion, and when you compound that from 2024 to 2040, when we become a majority minority country, that number is expected to reach $14 trillion with a T. 14 trillion. That's $42,000 for every single individual living in our country.
Wow. That's a salary for some folks.
Oh my God, yes. Absolutely. So for us, let me go back a little bit and I'll share the second slide, please. The reason why we wanted to do this is because of the great work that Daryl Gaskin, Tom Leviste, and others had done in 2009 when we were trying to make the case for health reform, Obamacare, the Affordable Care Act, to include robust health equity provisions. There, Dr. Leviste, Dr. Gaskin, and others got together and they crunched the number, again, looking only at physical health conditions, heart disease, diabetes, HIV/AIDS, you name it. And they found that conservatively, we were spending $300 billion. They then did another study with Eliseo Perez-Stable that was published last year. And in that report, they found that the number had increased to $451 billion. Isn't that something? And that's just, again, physical health conditions, racial and ethnic disparities in physical health conditions. So we said, let's build on that great work that they have done, and let's, again, make sure that we are pushing the boundaries and our understanding on these issues. So in 2020, we started working to look at the latest data that we could get our hands on. That was data from 2016 to 2020. Because the reason why we chose that date, we saw an increase in the number of suicides among African American boys, Native American children, and others. We also saw an increase in overdoses among Latino children, which was quite frightening to us. That was very interesting. And so we wanted to understand what is happening there and what is the cost, right? We wanted to look at the number of lives that were lost during that time prematurely. So these are excess deaths in terms of what we were expecting to be for that population group, right? Based on the economists. So we looked at those data and we found that almost 117,000 people had died prematurely within that time frame. And again, that report did not include the white population, just racial and ethnic minorities. African Americans bore the brunt of that at 56,000 people, 45,000 people for Latinos, and then Native Americans and Asian Americans. So we got an understanding of how many folks had died prematurely. Then we wanted to add that cost, because in this country, what we've recognized, we have never been able to realize, like I said, an equitable response, especially in policy, unless we can demonstrate an investment value to the government. Where the Department of Defense may be the gold standard in technology and investments, public health is 25 years behind that. Mental health is 25 years behind public health in many instances, right? Because of the dearth of investments. We spend only $281 billion for accessing mental health treatments in this country, $281 billion. And yet the global health, the Lancet's Global Health journal did a study and found that if we invest $1 in just scaling up treatments for anxiety and depression alone, the return on productivity and health and well-being is worth $4. Isn't that something? $4. And yet we only spent $281 billion. So with that said, we found that the cost during that time was $278 billion from the premature deaths that we encountered from those racial and ethnic groups. So with that, looking now into the present and the future, we said, let's project out the costs, because we want to know the projected costs and we want to know and understand the economic impact. And that's where you see the numbers on your screen moving in that direction. So
then when we're thinking about the cost of all of this, is it a simple solution of we just need to invest more, we need to put more money into providing resources, providing services, being able to address the premature deaths? I mean, do we know what the answer is?
So I would say yes. Money is always an issue, as we know, right? Because again, there's a dearth of investments. But it's just more than that. As we highlight in the report, looking at it through a social determinants and political determinants of health lens, what we wanted to understand is what was truly, driving these increases in chronic diseases, right? Both the body and mind moving forward. And of course, stress and trauma are the root cause of many of these issues and the increases that we see and the disproportionalities that we're seeing among population groups. But again, at our School of Global Health, what we have focused on with political determinants of health is to understand how policy and politics impacts our health. What drives those? Every time that we've been able to advance egalitarian or equity-focused policies, we have seen the health of the entire nation improve. Civil Rights Act is one case, right? In the Civil Rights Act, there was a study that was done by Nancy Krieger and team at Harvard School of Public Health, and they found that from 1965 to 2005, there were 38,600 black infant deaths that were saved because of that law. Wow. The Voting Rights Act, again, another study just published earlier this year, showed that African American infant mortality rates were decreased by 20% because of the Voting Rights Act. So it's not simply just money, although those investments are absolutely critical, but we have to look at the entire continuum, we have to look at the whole ecosystem, and we need to go not only at the individual level, but also the midstream and that upstream level to address the political determinants of health.
Wow. When you hear the percentages, the number of lives that can be saved and I'm thinking of infants, they haven't done anything.
Exactly.
They're just popping out and crying maybe, but they haven't done anything.
Right.
And their lives are being saved when we're able to look at how these policies are affecting this. So I guess my final question for you then, looking at where we are now, we have these numbers, we know that there are solutions. Is there hope? Can we see this change by 2030, let's say?
Well, there has to be hope, right? We have to do this because when I think about where the world is heading, there was, again, just to put it in a global context, since that's what I've been focusing on, there was one study that was done showing that the cost of our failure as a world to rein in these mental health inequities was $6 trillion by 2030. We wanted to understand what the cost is to the United States. We now understand what that is, so we need to do better. I think it is about making sure that at whatever level we are comfortable, whether it is that interpersonal, that intrapersonal, the institutional, or even the structural level, we all have a role to play in addressing these inequities. We all have to understand how the levers of policies have been used to either hinder or advance mental health equity in this country. And again, I would implore folks to look at it from the workforce all the way to the interventions. We know that there is a great need for interventions, but we need a whole of society, a whole of government, society, philanthropy to come together to meaningfully address these problems. Because if we don't, we'll continue to just merely nibble at the edges of the problem like we have in the past. So that would be my admonition.
Wow. Daniel, thank you so much for bringing these statistics and visual of what we are spending and all of this. Thank you so much for your expertise. Thank you, Daniel.
Thank you, everyone.